stage.
What's going on, everybody? It's Nurse Bass. I'm back with another video. This is going to be week 6 and week 7. I think I'm going to start doing my videos like this as far as my chronological documentation, just in 2-week increments. It'll make it easier and overall less videos. But before I start this video, I want to mention 2 things. One, I probably haven't mentioned it before, but I'm a big fan of cinema, of film, and acting in general. And I don't know how many of you know the show House, MD. If you've seen it, you know the character Greg House, the doctor. He's got a bum leg, right? He had like an infarct in his thigh, and so he's always popping Vicodin for it. So he's always in chronic pain. Well, there's this one episode and this one scene in particular that I just watched where it's like if you're not paying attention, you're gonna miss it. It's like one of those little gems that you really have to be paying attention for. But anyway, Dr. Cuddy is talking to him and she says, "You don't have to be in pain to be a good doctor." And he said, "I'm not interested in good." And I really love that because I felt like I could relate to it a little bit. You know, just the whole not really settling for mediocrity, not being complacent, really striving for something better than great, something better than good. Anyway, thought I'd throw that in there. Before I get started, I just hit the 200 subscriber mark. Yay! But anyway, before I ever started this channel, I just did it to document my journey through nursing school so I could reflect on it later down the road. I never thought that I would have anybody subscribe to my channel, much less 200 people. So that being the case, I want to take a little page out of Nurse Merce's book and shout out some people who have consistently been commenting and following me for a little while now. And I'm going to start with Nurse Merce. It's a good dude, man. He's like my YouTube nurse brother, what have you. It's a good dude, man. If you aren't following him, I'm going to leave everybody's links in the description below so you can go follow them if you want to. But he always puts out good content, and you know, he's always repping the Lord in his videos, and I think he's gonna have good things coming his way. So shout out to you, buddy. Tiffany A, she's cool. She's always leaving positive messages, and she follows me on Instagram also, and says nice things on there as well. So shout out to you. Jen Loves Nursing, been following me for a while. She has her little channel. You can go follow her. Like I said, I'll leave it in the description below. The lovely Rachel P, if you don't know about her, get out from under that rock you've been hiding under. She's cool, she's dope, she's got great videos, always putting out great content, so you can go follow her if you want to. Nurse Steven, the Razorback Man, you need to put out videos more often, buddy. I think everybody would agree. Shout out to you. The Long Road to Nursing, Jenny's Journey. She just recently started following me, but you know, like Tiffany, she's always got positive and nice things to say. So, and I really am appreciative of all these comments that you all leave me. Nursing with Rebecca, you may not have heard of her. I don't think her following is very extensive, but she's one of the first people who started following me whenever I made this little account. So shout out to her. And I think Rachel was also one of the first as well. Jamie Blankenship, I hope I said that last name right. She recently started following me also, but she's had nice things to say. And also, like Nurse Merce said in his previous video, she started up a forum for nurses, future RNs, and I'll leave that in the description as well. You can go subscribe to that, and it's just supposed to be a little community for nurses and nursing students to collaborate and talk. But let's help get that thing off the ground for her. Lastly, Victoria. I believe it's Victoria Journey on here. She's completing prereqs for nursing school, so shout out to her for her comments and nice things that she has to say, and good luck to her as well. So all of you, I really thank you. I really appreciate you. 200 subscribers. I never thought that would happen. I hope you stick with me. We got a lot more videos and ideas planned in the future, so let's keep this thing rolling. All right, so last week, week 6, I got sick as a dog from my wife, so I missed some skills that we got to do, but there was an emphasis placed on respiratory, learning a lot of respiratory medications, learning how to administer inhalers, breathing treatments through nebulizers, applying oxygen, things of that nature. I missed that, but we also, later on in the week, I did get to attend. We started doing some sterile technique, putting on sterile gloves, in and out catheters, indwelling catheters, condom catheters, all the catheters, basically. We started learning how to do that, and you know, it's in and out and indwelling or sterile techniques, and so that was pretty nice. And also, it actually came kind of naturally. I was kind of nervous because I can't stand doing things that involve steps and you have to follow it in a specific order, because I'm more of a just do it and I learn better that way. But whenever I have to do certain steps in a certain order, I get nervous about it, but it actually came pretty naturally. So that was, I guess, exciting, a nice change. The way that they grade our skills component, it's a separate criteria where they have, they judge you based on, and it's skills and clinical at the same time. And it's like communication skills, your teamwork, how you perform certain skills. I don't know, it's an entire long list of criteria. But we just got back grades for like the first 5 weeks. And the way that they grade it is you either get an S for satisfactory or a U for unsatisfactory. And if you get X amount of U's, in a row, week after week, then you might have to do some remediation and you have to meet with your professors. But anyway, we just got them back, and for the first 5 weeks, for this long list of criteria, I got all S's, all satisfactories, which got me thinking. I was like, because they said you're gonna get some unsatisfactories, and if you don't, then something's wrong. We need to advance you to the higher levels of nursing. They were joking, but I saw that and I was like, well, they must be giving everybody all satisfactories for the first 5 weeks, because how in the world did I get all satisfactories? But I actually was, after talking to some of my classmates, they asked, how many U's did you get? And I said none, and they thought I was joking because they did get some. And so that was a nice little confidence booster to know that maybe I am kind of getting the hang of it, the hang of these skills and the hang of this nursing thing, which is all brand new to me. But yeah, that was a nice reinforcer that I'm doing something right. Now this week we would have started on GI and GU, but Monday through Thursday we got snowed out, so we missed Monday through Thursday. We would have started doing NG tubes, inserting them, irrigating them, removing them, feeding tubes, all of the different kinds of enemas. We would have started these skills, but we missed that. But yesterday, I had my first pharmacology exam, which I was prepared for. It's that we had a list of medications that we had to do drug cards on for the first couple of weeks. So, a lot of analgesics, respiratory meds, NSAIDs, things of that nature. That was on the test. The different kinds of injections, the different angles that you would give injections for what specific route, the different kinds of gauges on the needles. Basically the introduction to pharmacology is what it was. A lot of dosage calculation. I feel like I did okay. We haven't got the grade back yet, but I'm sure I at least got a B, which is all that I need. Also, we got our hospital parking stickers for our clinical site, and we also got our hospital badges with our our names and pictures. And that was exciting, man, because we've been waiting for weeks for that. And we got that because today was technically our first clinical day, although it was mainly an orientation, getting introduced to the floor that we're going to be working on, touring the entire hospital, just getting a feel for what we can expect next week, which is technically our official first day when we officially get to start doing patient care and taking care of people. So it turns out that we're going to be working on a renal floor, which I think is really interesting, and I'm kind of excited for it because, well, first of all, we got introduced to the floor, got introduced to the kinds of patients that we're going to be taking care of. We got to look at the different dialysis machines, the hemodialysis unit, which is kind of like a separate entity of itself within the renal floor, which it was really interesting. And but I'm excited because, Nurse Merce just mentioned in his previous video how I was talking about it's a trial by fire kind of thing. That's what our professor was saying, that the renal floor is. It's like a med-surg floor. It's like, she said, it's like if you can survive and thrive on a renal floor or a med-surg floor, then you can work anywhere within the realm of nursing. I'm excited for that because, and not to knock anybody, because of course you got to abide by whatever clinical rotation you get that your nursing program assigns to you. But there would be a difference between having a clinical rotation in an area of the hospital or what have you, where it's kind of laid back, at least for your first semester in nursing, where it's kind of laid back. There's not a whole lot of expected of you. It's not real hectic or crazy. There's a difference between getting that and getting thrown to the wolves, like Nurse Merce said, on a renal floor or a med-surg floor or maybe an ICU, where it's a very difficult floor to work in. And being a newbie, getting thrown into the wolves, I really like that, man, because it's kind of like you get the worst, it's only uphill from there. And furthermore, I'm not here to be complacent. I want to continuously get better and strive for greatness. And I mean, it sounds corny, but that really is my mindset. And so I'm very glad that we got the renal floor. I'm very excited. I'm looking forward to it. And as far as my first official clinical day goes, I got a video planned. I'm not exactly sure in the release date, but it's going to be hopefully next weekend after the first day. It's going to be a collaboration video, hopefully with a fellow YouTube nurse here on YouTube. And if everything goes according to plan, it's going to be very exciting. I'm very excited for it, and hopefully it'll be a nice treat for y'all. But yeah, that was basically it. That's week 6 and week 7. Again, thanks to everybody who's subscribed to me and following me, and I appreciate all of y'all. Like I said, I never intended to get any subscribers, never thought I would. But here I've found 200 something people that can endure my ramblings. So I appreciate y'all very much. If you want to, leave a comment below. You know, I never say that in my videos really, but leave a comment below. I do like to hear from you all. Any questions you have, any video requests, whatever it may be, you can leave it below. I'll see y'all next time. That's pretty much it for now. Nurse Bass, soon to be. Peace.